friends. Welcome to the Pain-Free Birth Podcast. I'm your host, Karen Welton, a certified doula, childbirth educator, and mother of three. In this space, we'll hear positive, supernatural, and yes, even pain-free birth stories from women just like you. We'll explore the deeply spiritual side of childbirth and how God designed women's bodies brilliantly for birth. Let's get started. Welcome back, ladies. Today, I'm so excited to be interviewing Michelle Jorgensen. You may know her as Living Well with Dr. Michelle on Instagram. She's a dentist and a naturopath. Welcome to the show, Michelle.
Thank you. I appreciate you having me on today.
Well, I'm so excited to talk to you because, as you may know, and as some of my listeners may have seen on Instagram, I went down a rabbit hole of researching dental and oral health and how that contributes to our overall well-being when I had to have a tooth extracted. And I had to decide between, am I going to get a root canal or am I going to get the tooth extracted? And what are all these long-term, risks of root canals that I'm hearing about? And is this something I want to, risk myself? But you're also saving the tooth. And there's this whole, I'm finding out about fluoride and I'm learning about cavities and I'm learning about all these things. And there's so much differing information out there in the health space among dentists and oral surgeons. And many of my local dentists, I saw probably 4 or 5 specialists and dentists and surgeons, all but one recommended root canal. So I thought, man, I need to figure out what is going on here? What's the truth? I'm a big researcher. For anyone who follows me probably knows that, usually in birth and physiological birth. But I realized this was a topic that so many of you were interested in. And so I wanted to bring on Dr. Michelle here because I found her account so helpful in really clearing the air on a lot of the questions I had surrounding cavities and root canals. And so I want to bring this discussion to the Pain for Birth podcast because I feel it is so important for not only just women to understand how our bodies work and oral health, but especially pregnant women because there's an increase in cavities and changes happening in your mouth when you're pregnant. And so it's even more important during this time to see your dentist. And so I'm inviting Dr. Michelle on because she has just a wealth of information surrounding these topics that I want her to share with you guys. So Michelle, would you kind of introduce yourself and let us know, how did you get into this kind of work?
Yeah, thank you, first of all, for wanting to know more, because I think this is really important. And I'm always excited to talk to mamas, pregnant mamas, and after you've had children as well, because there's so many of these topics that are important to know now while you're expecting, and even for you and for your new baby as well. So thank you. It's interesting. I did not get here intentionally. That's always the thing I start with. It wasn't an intentional path. I was a general dentist practicing. I was focusing a lot on cosmetic dentistry and started getting sick myself. Didn't know what it was. And my biggest symptoms were my gut was just trashed. I couldn't eat anything. And I had really bad numbness. I couldn't sleep. I couldn't blow dry my hair. I couldn't put on mascara, like nothing where I could raise my arms at all. And it got to the point where I couldn't even hold instruments at the dental office without my hands going just painfully numb.
Wow.
And then memory, I've always had like this really good memory and I couldn't remember anything. I couldn't remember a patient's name from room to room. So it was drastic. Like there was something really, really wrong. So
wow.
I actually had my practice for sale. I didn't know what I was going to do. I was a young mom myself, young mom of 4 little kiddos. And, I was the person who puts food on our table and our practice, my practice, my husband worked in it as well. So if I was going to not be able to do dentistry anymore, we were out of a job completely. So this was a big deal for us.
Yeah.
And I started looking for what was I going to do now. If I was going to coach or consult, I always liked to teach. So I thought that was maybe a pathway. And along that pathway, another practitioner said, you sound a lot like me. Have you ever looked into mercury as being a problem? And I said, well, I don't have any mercury fillings. I knew that the silver fillings, what we call silver fillings in our mouths, I knew that they had mercury in them, but I'd never been told that could be actually dangerous for the dentist. But my practice was largely cosmetic at the time, and people don't like the way those fillings look. They call them the black fillings. They're not very, they don't like the way they look in their mouths. So I was taking out a lot of these fillings and never even realized that while I was drilling them out, all of that mercury vapor was released and coming right into my head. So I got tested, thought, well, I don't have anything to lose because doctors had no answers for me. So I had nothing to lose, got tested, and that's what it was, mercury off the charts. And I had never been told that that could be a problem. Not only
Wow.
that, but those 4 kiddos, because I can talk about this on your podcast. Those 4 kiddos came very, very hard for me. I actually had in vitro for my first 2, had twins, and then we adopted the next 2. I've never gotten pregnant on my own in over 30 years of marriage. And I've since
Wow.
learned that mercury is also very impactful on fertility.
Hmm.
And I am now going to tell every female dentist that I know that this is something that you should be aware of and you should be cautious of. So I also think it affected my fertility and everything else in relation to that.
Yeah.
Unfortunately, at that point, by the finding out point, I was beyond done with having children. So there were no more kiddos coming my way. But I think that, so I started having to clear out all the mercury to be able to get well in a lot of different ways. And the doctor said, well, you can't keep putting it in if you're going to try to take it out. So if you're going to keep being a dentist, you have to learn how to do it without breathing in all the vapors. And I didn't know if there was a way to do that. So I had to start searching, and I found an organization that actually was built pretty much around this concept of what's called safe mercury removal. So
Hmm.
there's additional precautions that are taken for the patient when it's done, but also for the dentist and the dental assistant and, everybody in the office. There's extra precaution that's taken. And so I started doing all of that. And all of a sudden, my patients started saying, what in the world are you doing? Like, you're coming in with this crazy looking mask on and you're covering me and you're, doing all of this. And so I would explain, well, this is for my own health. But obviously, I'm excited that this is going to help you too and make it a more, a healthier procedure, a safer procedure for you. And all of a sudden, things started picking up and people would say, well, gosh, actually, I've been looking for somebody like you, or my doctor's been looking for someone like you. And then doctors started reaching out and asking, well, do you also do this? Because we can't find a dentist that can do this as well. And I didn't know what they were talking about. They were bringing up things like ozone. I didn't even know what it was. Stem cells. I had never even thought about using those. I mean, just a lot of things that I had never heard about inside of dentistry. And so I had to go learn what they were teaching me about, doctors and patients, what they were saying, hey, we've heard this could be a thing. Why don't you go learn about this? I had to go find obscure classes all over the place. This was, 10 years ago, and eventually realized that there are so many health implications long past just mercury. Mercury was mine, but there are so many others inside of dentistry. And honestly, we as dentists don't know them. That's the tragedy in all of this, is we don't know them. So this is why I'm so excited to teach all of you, because when just like you said with Karen, you had to go find dentists and had to go find, unfortunately, you had to go to a lot of different places and get a lot of
Hmm.
different opinions to find the answers. My mission is to help people know so that now
Yeah.
you find practitioners. And I have a directory on my website that are vetted dentists, so that
Hmm.
you don't have to work so hard to find somebody. But
Yeah.
that's really how I got where I am, because I got sick. I had to find an answer. And along the way to my answer, I found a whole bunch of other things that no one is talking about inside of dentistry, or at least they were in 10 years ago.
Yeah.
Thankfully, now there are a few talking
Hmm.
about it, and it's things that need to be known. So thank you for allowing me to talk about it.
Oh, we're so happy to hear about it. And honestly, it's, what I came down to in this search for myself was in making this decision of, root canal versus get your tooth extracted, which is seems to be a more extreme, course to take, of get the whole tooth taken out. But, and in juggling with this, like, why are so many dentists still recommending root canals, or still, have no awareness of the health implications of all these things we're talking about and that you're bringing up here? And I just kind of took a step back and realized, wow, it's not really any different than the birth space. It's no different than all the obstetricians that just think, oh, it's no big deal to cut a woman open and do a cesarean, and versus the natural health space where we really take these things seriously, and we think, women can deliver babies. We don't need all this medical intervention. Or, most of the health industry, throughout my journey just of research, and I think many of my listeners are along in this path to at different points in the journey of realizing that, the modern medical system, at least the Western one in America and in other parts of the world, doesn't always get it right. And very often we're causing more damage than we are helping people. And so our our approaches to health are typically symptom related. They're pain, and they see things as all separate. We don't realize that the mouth has a direct effect on the rest of the body, or that how we give birth can affect our postpartum, our motherhood, our mental health. Oh, there are so many things connected. And just like I realized that there was so much I don't want to say misinformation, because that's kind of what they call what we're talking about is misinformation.
Yeah.
But there was so much that was not understood, that there was limitations, and frankly outright lies in many cases when we are looking at and studying modern medicine and their approach to health, that it wasn't really truly contributing to health. It was reactive, it was symptom based, it was heavily relying on prescriptions, and in many ways controlled by the pharmaceutical industry. There's a whole, we could go down many rabbit holes here, which I don't want to focus on this podcast, but it just really hit home for me again that it's like, what, Karen, it's no different than the birth industry, than, the modern medical birth industry that we shuffle women through, and they end up with birth trauma and, all kinds of stuff. It's no different than many of the ways we approach disease and medicine in this country. And dentistry, you have again here this split between traditional dentists who they're now realizing, yeah, Mercury's not the best, but they're still behind the times on a lot of other issues that we're going to talk about in this podcast. And in order to really find the truth about how these things impact our health, you have to sometimes go off the beaten path. You have to go off the main consensus of what everyone believes and look into alternative medicine, into holistic medicine or holistic dentistry. And so having gone this route in many other areas of my life, it wasn't so much a stretch for me to realize, what, just because the majority of dentists might not have the same beliefs, this just ask yourself, and as you're listening to this, ask yourself, does this make sense? Is this logical? Like, would it make sense that if I put heavy metal into my body, it could affect other parts of my body? And I think,
and Mercury, think about all the things they talk about. They say, don't eat fish, don't eat fish, don't vaccines because of, the mercury in it. But they don't talk to you about the fact that the filling that's in your head is actually 50% mercury.
50%. Yeah. And we think, oh, well, that doesn't have any effect. It's just small, minute amounts, right? That's always the response.
Yeah. I really believe too that part of the problem here is that it's very difficult just on a surface level to connect A plus B equals C. So, let's say you had that root canal done, and down the road, 3-4 years from now, you're finding that you're having a hard time getting out of bed in the morning. You're tired, you're always run down, you just don't have the energy that you want. And then an autoimmune disease starts popping up. You have to get Hashimoto's, and then another one shows up, and then another. And in what world would you connect? Oh, I bet it's that root canal that I got 3 years ago. So there's just not a connection there from a patient standpoint or a practitioner standpoint. Most dentists, and this is really a symptom of the specialization of our medical care in our world, and particularly in the Western world, everything is so specialized that a patient isn't coming back. You are not going back to the doctor that did everything.
Right.
And so nobody's putting all of the pieces together for you, because you're showing up at an endocrinologist to talk about your fatigue and your thyroid levels. Well, that endocrinologist has no idea what happened with your birth situation, or has no idea that you had a root canal done. There's no one person that knows your story other than you. And so as a practitioner, and I get it, and I am the last person to ever put down dentists or dentistry or anything else. I won't do it, because I'm very much part of it. I see the limitation in our view. Does that make sense? So, we just literally don't see very much. We don't see beyond what's in your mouth. And often we're not talking to you about your thyroid. We're not talking to you about any of these things.
Exactly.
So we have a reference point to put them all together. So that's why I love people like you who are really saying, listen, just ask questions. It's actually okay. And you know what? Find a practitioner that's okay with you asking those questions. And if they're not, then they're not the right one for you. And I'll tell people that all the time. If they won't answer a question, well, most likely they don't have the answer. That's the first default mechanism that we all have, is if we don't have the answer, then we just say, no, you're wrong. Well, usually they actually don't know that you're wrong. They just don't know that you're right either. They don't know. And as a practitioner, we're supposed to know everything. We're supposed to be the be all end all of
Hmm.
knowledge about things. And so if you go and you start asking your dentist about root canals, about fluoride, well, all they're going to talk about is the things that they know, which is typically what they've been taught in school, and which is not anything about this. I'll tell you that right now. Not anything about this. And what they've been taught in school, or what they've been taught at their local dental association meeting, which is none of this either. So they're just going to tell you what they know. And unfortunately, it's not everything they should know. So that's really where I'm, trying to teach you and everyone about this. And people often will say, well, what does holistic mean? What does all of this mean? And what is a functional dentist? And what is like an integrator? Like what are word
Yes.
biologic dentist, biomimetic? Like what are all these words mean even? And really what it is it's a symptom of the dentistry itself doesn't know what to call themselves either. All the rest of it. So, there's no really official term for it. So I first started out calling myself a holistic dentist. That's all I knew to call myself. And the funny thing is when you use the word holistic, you either get two responses. One is, oh, that's what I want, because people who say that, they know what it means. Holistic means the whole body. Like everything's, talked about,
Connected. Yeah.
understood, all as one complete whole, which obviously we are. I mean, hello, have you ever noticed? You're kind of one piece top to bottom. So, it is holistic care, meaning it's all whole. But there's also a whole nother response that comes with holistic, which is like, oh, you're the crazy people. All right. So when I go to your practice, you're going to have like beads hanging in the door and incense burning, and you're going to be doing all sorts of crazy voodoo stuff that has nothing to do with science. So that was a strong enough, like, I said, I'm a holistic dentist. There were enough people that went, oh, and nodded like,
You're one of
oh,
those doctors.
all right. Yeah. None of what you do is really trustworthy, everything else. There was enough of that sentiment and stereotype that actually I just start calling myself a health-based dentist. Because when you say health-based dentistry, it makes sense, right?
Yeah.
I'm just
Yeah,
all about
you're focused on the whole health of the body, which is
about your
a
health.
much more Eastern way of looking at the body. In Western medicine, the specialists only focus on that organ or that disease or that, symptom of what they're treating, not the
Yep.
whole body. And that's exactly the shift in mindset I think you're talking about. That's at the root of what we're talking about here today, is looking at how does everything we do to the body affect other parts of the body and the overall health of the patient, some of the questions we need to be asking in all of our health questions to our doctors, our OBs, our dentists, our endocrinologists, everybody,
Yep.
our fertility doctors. Like we
Yep.
need to look beyond just the presenting symptom and go, how are all of these things connected? Because like you said, we are one whole organism. Can you quickly explain what is the difference between a holistic dentist and a biologic dentist or a functional dentist, or are they all the same?
They're all pretty much the same thing. It's
Okay.
all us trying to figure out what to call ourselves. There's no standard in the industry. So there's no, you take this exam and you become this. That doesn't exist. There are a couple of organizations there's one called Biologic, International Association of Biologic Dentists. They do have a certification exam, but it's really not well known, so you don't have to be certified in the organization to call yourself a biologic dentist. So functional dentist is basically saying, listen, the function of the body is related to the mouth.
Mhm.
Got it. Biologic dentist basically means we're paying attention to the biology of the body in relation to the mouth. Got it. Integrative means we're going to integrate other modalities in relation to the mouth. Got it. Biomimetic is the only one that's maybe a little different, and that's a term that's sometimes used. Biomimetic is often more about the way they do the fillings. So if
Mm.
you're looking at biomimetic dentists, they're mimicking nature, mimicking bio, basically mimicking life is what bio means, life. So biomimetic means mimicking life. They're mimicking what a tooth used to be before it had a hole in it, basically. So how do we rebuild it the way that nature built it in the first place? So biomimetic may be more just about the way they're going to fill your tooth. Biologic, functional, holistic, integrative, they're all pretty much the same thing. They're all
Okay.
focused on overall health.
Good to know. And if someone is listening to this podcast, realizing, oh man, I want to see one of these dentists,
One of these.
one of these, how would they go about doing that? Are there networks or organizations or websites they can go to?
Yes. So I actually, on my website, livingwellwithdrmichelle.com, I have a directory. And here's the crazy thing. I get about 20,000 people a week looking for a dentist on that directory.
Wow.
So what that gives is a huge marketing advantage. Now I'm going to dentists saying, okay, get your name on here. My goodness, could you be, if you are working inside of the space, get your name on this directory because there are so many people looking for you. There
Yeah.
are a couple of directories that I don't recommend as much anymore just because they're not as heavily vetted as mine, but there are a couple others and we can put them in show notes. But basically, IAOMT is one, IAOMT.org. And then there are lots of, basically, there are lots of letters, IAB.org. So those two directories, both of those sites have directories on them. They're good directories, but they're not as vetted. So you're going to have to look through them and you're going to have to go to their website and say, okay, are they actually talking about the things that I want to know here? And make sure that they actually are talking those things. For example, if they're saying that they do root canals, well, that might not be the place that you want to go because you're going to have a bit of a fight if you shouldn't have to have a fight with your practitioner. I know you probably talked.
I have had many conversations with practitioners that help me realize, wow, they do not all think the same way.
You shouldn't have to fight with your practitioner. It's your own body, and you should have
exactly.
here. But anyway,
So,
make sure you're vetting.
Yes, absolutely. That's so important to vet and ask the right questions. And we'll get into some of those, like what questions you can ask and what to really look for. Tell us a bit about fluoride. That's a big topic. Every dentist recommends fluoride, brushing with fluoride, fluoride rinse, fluoride mouthwash. My pediatric dentists recommend fluoride. What do you call it? Treatment and there's a
rinse and all the
everything.
above.
Everything is fluoride in the dental world. What's the problem with fluoride?
So the idea of fluoride is awesome. In the 1930s, they figured out that people who had more fluoride in their well water actually had more cavity resistant teeth. Unfortunately, the teeth were also kind of splotchy, really chalky white and kind of yellow. So they didn't really look that great, but that was higher levels of fluoride. They also didn't really get cavities. So government looked at this and said, wow, all right, if fluoride can prevent cavities, then why don't we add it to toothpaste? Why don't we add it to water? Why don't we add it to all of these things? Let's see if we can't prevent cavities. The idea is awesome. That's a great idea. I love it. Unfortunately, it hasn't worked. There are increased levels of cavities today than there were in the 1930s even. So it has not worked to incorporate fluoride in all of these products and all of these, in the water and all these things. It actually hasn't decreased cavities. But the problem also is that fluoride doesn't just affect the tooth. Remember, we're talking about a holistic system here, a head-to-toe system here. The fluoride doesn't just move, when you ingest it or whatever. It doesn't just go, oh, I'm gonna just find the tooth. That's the only place I'm gonna find. No, it actually affects other organs and other things in the body as well. Fluoride actually changes the structure of something called hydroxyapatite, which is the mineral that you see right here. It's the mineral that your teeth are made of. So it's the enamel of the tooth. It's actually the mineral that your bones are made of as well. So if it's going to change your tooth, guess what it's going to do to your bones? It's going to change your bones too. And what they're finding is much higher rates of fracture levels in areas that have high fluoride in the water because fluoride makes the bone more brittle. Well, if it didn't really serve its purpose to reduce cavities, but yet it's making bones more brittle, is the trade-off worth it here? Probably not, but that's not where it stops. Fluoride also interferes with thyroid hormone. Thyroid hormone is activated by iodine. Well, fluoride and iodine are cousins. And if fluoride's in the system, it will bully iodine, push it out, and it will activate the thyroid hormone, but you can't use it. So you show up with low thyroid symptoms, but yet you take a blood test and it says you're just fine. Your thyroid levels are normal, but I feel cruddy. Why? Well, it's because fluoride is interfering with the way your thyroid hormones are working. So now it's leading to a lot of hypothyroid issues. All right, number 2 problem. Third problem, big deal for your listeners, is that it actually is affecting IQ levels. And this isn't one of these just, hey, I'm a crazy person and I want to say this. Go on PubMed if you really want to go. There's PubMed research showing that it literally is decreasing IQ levels in children in highly fluoridated areas. So now I've got 3 strikes against me. It makes me break bones, it's decreasing thyroid function, and it's affecting IQ. But yet it doesn't actually even decrease cavities. Is it worth it? No, it's not worth it. So instead, let's do what the problem requires. What is a cavity? It's when there's a hole in the tooth. The hole in the tooth is from acid. Either from acid the bacteria create because they ate sugar, acid from your food, acid from a lot of different things. What happens when that acid sits here is it creates a hole in the tooth. What's lost? Minerals. Minerals are lost or pulled out of the tooth. The acid pulls minerals out. Then that leaves a hole. Bacteria crawl in. They drop more acid. They build a deeper hole, bacteria crawl further in. This is what a cavity is. So the key is, let's just put back what was lost, which is the minerals, hydroxyapatite. So cavities can be absolutely, and this is again researched, it's as effective as fluoride in reducing cavities, is products that have hydroxyapatite in them. Hydroxyapatite is just the minerals that your teeth are made of. That's all it is. So you need to find a product with hydroxyapatite. I didn't love all the products on the market, so I actually formulated my own. I have a hydroxyapatite tooth powder, I have a kid's version as well, and a hydroxyapatite mouth rinse, because I am completely fluoride free in my practice. I do not recommend fluoride at all because it's not worth the side effect. That's the problem. It's not worth the side effect. Does it strengthen teeth? Absolutely. 100%. Every dentist would agree with me. This is why dentists tell you, do it, do it, do it, do it, do it. It strengthens teeth. It does not prevent cavities over the long run. Research has shown, and it causes all sorts of other issues.
Yeah. I saw one dentist, I'm not sure if it was you or someone else, said rinsing with like fluoride mouthwash, for example, is like carpet bombing your mouth. You're killing all the germs in your mouth. You're killing the ones that cause cavities, but also killing all the good ones too. Tell us a little bit about like the mouth microbiome. I've learned a lot about this in the birth world with our gut microbiome and how important that is to make sure that you have a healthy gut, because you pass that on to your kids when you give birth vaginally. And that really is 80% of your immune system. It affects everything, whether you get autoimmune disease, how you react to foods, but there's also a mouth microbiome that affects our health as well. Can fluoride and fluoride mouthwash and oral health impact that mouth microbiome? And what's the best way to take care of it?
The biggest thing that impacts that is traditional mouthwash. So when you're looking at Listerine, what's the number one component in Listerine? Alcohol. If you look, it's like 60-70% alcohol. That's why you get that burn when you use Listerine. And a lot of these mouth products have alcohol in them. They have why do they have them? Because they kill bugs, right? Alcohol kills bugs. That's why you put alcohol on your skin when you go to the doctor and they're giving you an injection, whatever. They're going to put alcohol on the skin to disinfect the skin before they put it in. So when you put alcohol in your mouth, it's actually going to affect the biome. It's going to be just like you said, it's going to kill everything. It's not selective. It's going to kill everything in sight. Not only that, but when you're using an alcohol-containing mouth rinse, you're going to be swallowing that. Guaranteed. I mean, it's mixing with your saliva. There's no way you can't not. If you put something in your mouth, some of it's going down no matter what. So it's also going to affect your gut biome, because now you're giving alcohol to your gut biome, and it's going to completely change that gut biome as well. So when you've changed the biome, it affects cavities are basically bacteria. That's all it is. And if you kill everything, including the good bacteria, now the bad bacteria are going to flourish, the ones that create cavities.
Yeah.
So you're going to have a higher level of cavities because you're killing everything in sight. You're going to have higher issues of gut problems because you're killing everything in sight, and the bugs down there that are needed to do their work aren't there anymore. You've killed them all off. So mouth rinse is really, really important to use the right one. Never use anything with alcohol in there. Never use anything with a broad spectrum disinfectant, basically something that's just like trying to kill everything in your mouth. And most of these rinses do. A lot of these rinses also have sugars. So fluoride containing mouth rinse, it's bubblegum flavored. Guess what? That sugar just fed all the bacteria in the mouth. It makes zero sense to me why they're doing this.
Tell us about like xylitol. I see that in a lot of natural toothpastes and mouthwashes. What's your opinion on that?
Yeah, xylitol is actually, it's interesting. There's tons of research on xylitol. Xylitol does not cause cavities. Xylitol is not consumable by bacteria. Interesting. So no bacteria can eat it. And that's why cavities form, because they eat sugar and then they poop out acid, and then the acid dissolves the minerals. Well, bacteria can't eat xylitol. So I actually have it in my mouth products for that reason. But I don't use it as, say, a sweetener in food, because it's going to throw off your gut biome, because your gut biome actually needs some of those sugars. That's their food to be able to do their work. So you're going to throw off your gut function significantly if you're using it like it's the sugar you're going to use in making cookies. You go, oh, these are so great cookies. They don't feed cavities. Well, also they kill your gut. So don't use xylitol. So we use a little bit of xylitol, and it's very, very small amounts in the tooth powder, in the mouth rinse, because it makes it taste good. It makes it taste decent, but it's not feeding cavities. It's anti-cavity.
Why is it important for pregnant women, especially, to be really aware of what their oral health and to get those cleanings? Like, are there changes happening in pregnancy that can really impact cavities and this germ microbiome and what's happening there?
For sure. There's two ways that pregnancy really affects oral health. Number one is cavities. There's so many women that'll talk to me and they'll say, "Oh yeah, this crown and root canal is from this kid. This crown and root canal is from this kid." And,
Mm,
I never had a cavity until I had a baby. What's going on there? Well,
yeah,
what's going on there is that you are growing a human. I'm thinking about that. You're growing a human. You're growing a human when you're pregnant. You're growing a human when you're nursing. What does that human need? Well, you're growing bones. You're growing ligaments, you're growing tendons, you're growing soft tissue, you're growing teeth, you're growing hair, you're growing all of those things. Everything that baby has when they are born, you had to provide the building blocks to grow.
yeah,
So if mom, you don't have enough building blocks to grow baby's bones and baby's teeth and baby's hair and baby's everything and keep yours healthy, baby always wins. So what happens is that your body will donate minerals to feed the baby to grow those baby's bones, and you don't have enough. So it'll pull it from your teeth, it'll pull it from your bones to be able to feed baby. And so this is why you get cavities when you're pregnant, where you didn't have cavities before. You've got to super supplement and super feed yourself minerals during pregnancy. Otherwise, you're going to sacrifice your own self for this process. So
yeah.
I have a remineralization kit online. What it is it's special minerals. Again, you don't have to buy mine, you can buy anybody's, but it's specialized minerals that are focused on teeth and bone development. So you're growing your baby, and also vitamin D3 and vitamin K2. People don't realize that the mineral alone is just going to float around and cause gallstones, kidney stones, tartar on your teeth. That's not what you want a mineral to do. You want a mineral to get in, build your teeth, strengthen them, get into your baby, build baby. So it requires vitamin D to grab the mineral and vitamin K2 to put it in the cell. So you
Mm,
have to have those two things together in order to keep your bones and teeth healthy during pregnancy and during nursing. I also recommend hydroxyapatite on the outside. Again, let's put minerals on the outside. Let's put minerals on the inside. Let's keep you healthy. So that's number one thing that I see so many women suffering from. And often it's down the road.
yeah.
They come in after pregnant, like after, and gosh, I got this tooth. It's totally decayed now. What's going on? Well, baby took everything and now you're left with this. So keep your mineral levels high, keep your vitamin D and K levels high in pregnancy. Second one is gums. There are a lot of hormone changes in pregnancy. Have you ever noticed that in women? I mean, hardly any, right? Tons of hormone changes. And when those hormone changes, it actually changes the fluid flow in a tooth. It's crazy. Changes the way because again, body's pulling minerals into the body to feed the baby so it's pulling things from the inside, from the outside in. Changes a lot of gum dynamics. So a lot of things we'll just say, oh, that's just pregnancy gingivitis. What it is, it's bleeding gums, it's sore gums, because the body's literally pulling resources from your gums to use in the rest of you. So if you've got bleeding gums, if you have all this going on in your mouth, well, you're inflamed, which is then inflaming baby. You don't want this to happen, and it's leading you to an inflamed situation for birth. I know that's your talking points. So
Wow.
have to make sure that you're staying on top of gum health as well. Again, this is going to be mineral based. This is going to be vitamin based, and going into the dentist and saying, how am I doing? How are they looking? Oh, they're looking really red. They're really inflamed. Okay, that means I'm low. You've got to even up even more. So the cool thing about the mouth is it's a really nice dashboard.
Mm,
Look in the mouth and we can go, I see what's going on. All right, let's fix this quick, because we can see it, where I can't necessarily see your gut. I can't see your bones. I can't see these things, but I can see your teeth and I can see your gums, and we can go, oh, you're deficient. Let's add some more.
wow. That's fascinating. Like, oh, you're inflamed. It makes sense if you have inflammation in your gums, or you may have it in other parts of the body. It's just a symptom. It's like the warning light, the check engine light in your car, basically, is what you're saying. Like when you've got issues going on in your mouth, that's a sign it's also happening in other parts of your body. And this is just, I'm hearing you saying this, and to me, I'm thinking this is just another reason why as women, especially in pregnancy, we need to take such good care of our health and our bodies and our nutrition and our mouths, because it's not just impacting us, it's impacting our unborn children. And it's
Absolutely.
going to impact your birth potentially. If you've got inflammation, your body is not going to labor as effectively. You're not going to carry in your pregnancy. You're probably going to have more of those aches and pains, in your third trimester. You're going to be struggling to wake up in the morning, like you mentioned. Like you're going to feel more fatigued. Like all of these things have an impact and a stacking effect. And when we take care of ourselves, we can begin to lay those building blocks of getting good nutrition and good minerals. I've heard it with the mineralization is a big deal in pregnancy. Like you
Yeah,
said, the baby just sucks all those minerals, and it's not that the baby doesn't get them because the body prioritizes the baby. So, like
always.
you said, it takes it from the mother's bones, and your teeth are your bones. So it's
Yep.
pulling like essential minerals from your bones, and sometimes it can take 2 years to remineralize after a pregnancy. And that's why you can see even, I don't know if you know about this much, Michelle, but they've taken like pictures and studies of children that were born very close together. And usually the first child has a very strong bone structure and jawline. The
Yep.
second child, very often, if the mother was deficient in minerals, has
Yep.
a receded jawline and different and bad oral health and other symptoms as well because of the way that those minerals even build create, in the pregnancy, how the formation and the bone structure forms in the facial structure of that second child. So there are so many implications to oral health, and having proper mineralization and nutrition in your pregnancy. It's so important. And this just reinforces again the vast effects of making sure of our choices in pregnancy, making sure we're making those right choices. So thank you for sharing on that. Let's talk a little bit about the root canals and cavities. And I'm sure there's some women here probably also feeling like, oh my gosh, I've made the wrong choices. I have not focused on my health. I have not remineralized, or I have all these cavities. I'm making my appointment right now with the dentist. What's step one? And what are some practical tips you can give us to just take care of our health? I know you've given so many already. And then like, what are we to do if we're already going down that path? We've got cavities and they're turning into a situation where we may need a root canal or
Yeah.
other
Yeah.
options.
So let's talk about what that even means.
Yeah,
People always use, in fact, I always push back a little when people say I need a root canal. Well, really, are you going to die with that one? No. I mean, you made another choice, right? You
I
told you need a root
did. It wasn't
canal.
the fun option, but it was the one I chose. And
There's always another choice. So you don't need a root canal. No one needs a root canal. I people say, oh yeah, my dentist told me I need a root canal. I'm like, do you? And they just look at me. Well, I'm like, do you? Do you need a root canal? Like, will you die without that thing? No. So let's just talk about tooth, the way the tooth is made. There's enamel on the outside. That's the part we see. And we already talked about that. That's full of hydroxyapatite, of this special mineralized complex. The next layer in is called dentin, and it has a superhighway of tubes going everywhere in the inside of the tooth. That's how the nutrients, and then the very inside layer is called the pulp. It has the nerve, it has the blood vessels. So nutrients come up from you, or sometimes they reverse, vice versa. During pregnancy, they pull in to be able to feed baby. So there's this flow through that blood vessel area in the center of the tooth. And then it goes through the dentin, through those little tiny tubules out to the enamel. And that's how the enamel gets minerals. That's how this all works. Well, when a cavity is formed, like I said, it pulls minerals from the outside, and then the bacteria crawl into a little hole. If we don't get that bacteria out soon enough, then the bacteria eat sugar, drop more acid. It's not the sugar that causes the cavities. The bacteria eat the sugar, and then they poop out acid, basically, is how this works.
yeah, interesting.
Exactly. I always like to say it's pooping when it's kids, because they're like, oh, gross. Like, yeah, what it is. So their byproduct, that sounds better, is acid. The acid then dissolves more minerals. It's just like when you would pour Coke on the battery terminals on the car battery. Acid dissolves minerals. It is what it is. So acid dissolves more minerals. The bacteria are able to crawl deeper into the tooth. Once they get to that dentin layer, they then get into that superhighway. They then can go all the way to the nerve of the tooth quite quickly. So we tell people, because people will say, can I heal a cavity? The answer is yes, if it's still in the outside layer, if it's still in the enamel, because it's all about minerals at that point. We just need to get more minerals back into that spot. Bacteria out, minerals in, and you can heal it. Once it gets to that dentin layer, that's when a dentist intervention is needed, because it's already spread. It's already spread beyond that point. It's already on the superhighway. We got to get in there and clean the bacteria out and fill up the hole. So now if the cavity progresses deep into that dentin and starts to get near the nerve, bacteria drop an acid near the nerve. That's why it starts to hurt, right? This is the sensitivity that starts to come up. It's acid by the nerve. It's not feeling that great. So dentist will tell you, you need a root canal. Why? Well, two reasons. And one is reversible, one is irreversible. If the bacteria in the cavity are just close to the nerve, you're getting a lot of sensitivity. It's kind of cold and hot sensitivity, sensitive. It's achy sometimes. We actually can go in, remove the deepest bacteria, clean that out, and then we use ozone, which is a gas that's sprayed on the tooth and it kills bugs. Ozone is just 3 molecules of oxygen. Oxygen likes to be in pairs. It likes to have just two. So it's got this third wheel hanging out over here. Well, that third wheel goes and binds to bugs. So it goes and binds to the bacteria in the deepest layers of that dentin right next to the nerve, and it kills them. So we're able to actually fill over that deepest layer and keep the tooth alive. So in your instance, if your tooth was still alive, like if you could still feel cold and hot, if it was still alive, it's still savable. We're about 90% successful in saving a tooth at that point. We kill the bugs at that deepest level. So we don't remove the deepest level of cavity. We kill the bugs in it. So it's not going to spread. Because remember, it's the bugs that spread, the bugs that create acid. If we kill the bugs, no more spreading. We fill over it, we save the tooth, we keep it alive. If that bacteria has already gotten to the nerve, and it's killed the nerve inside the tooth. So this is when you get an abscess. This is when it hurts to bite on. This is when your face swells up. If any of those things have happened, the bacteria are already inside the nerve of the tooth. And at that point, you do only have two choices: a root canal, and I'll talk just a minute about a root canal, but a root canal or remove the tooth. Just take the tooth out because the nerve inside is already infected. That's the problem.
Yep.
Now, why would you choose one over the other? Well, it's all about those tubes. When they do a root canal, what they do is they actually go in and clean that nerve area out. It's in a little canal inside of the tooth. This is why it's called a root canal. It's a canal inside the root. So they clean it out, disinfect it, and fill it up with a plastic-like material. Then they put a crown or something on top of the tooth and you keep on chewing. It sounds awesome. Like, it is so awesome, right? You get to keep the tooth.
You keep the tooth. Yeah. Remove the nerve, remove the big, all the infection, keep the tooth.
Awesome. It sounds so awesome. I love the concept. And it was done to save teeth. And really, as dentists, like, that's what we're trained to do. We're trained to save teeth.
Yeah.
So it's awesome. But there's a problem. And this problem has become more and more apparent as we have better imaging techniques. Now we can see what's really happening. So what happens is that main canal is filled and cleaned. But those little side tubes, there's literally a mile of them in every tooth. They are too small to clean and too small to fill. So nerve and blood vessel tissue are in all of those little tubes because that's how the nutrients are transferred. So they clean out the main one and basically seal all this dead tissue inside of those little tiny tubes. That's the problem. So now bugs love dead stuff. They're going to eventually find a bacteria, going to find the dead stuff still in this tooth. And then your immune system is asked to keep those bacteria at bay. So this is why we see immune system function or dysfunction downstream from root canals, because your immune system is so busy keeping the tooth healthy that it sometimes can't keep you healthy. So we see autoimmune issues because the immune system's kind of distracted, keeping the tooth healthy all the time. We see things like cancer because it can't fight off all the bad things that are going to happen to the body because it's too busy taking care of the tooth. So it has all of these other implications. And then the bacteria start to win the race. They start to win the fight against your immune system, especially if your immune system has to deal with other things. Like, let's say a virus comes along a couple of years ago. All of a sudden, all these people had teeth that blew up. Why? Well, the immune system was really busy doing something else. Let's say you have a birth and you go through, a fairly significant life event, either physically or mentally, emotionally, and your body just can't keep up with all of it. Bacteria start to grow. They start to eat away the bone at the end of the root. Here's the tricky part. You don't feel it. The nerve's gone. You don't even know what's happening. But we have a new diagnostic technique, imaging technique called a cone beam CT scan. These are in dental offices, and it's a specialized CT scan that I take of your whole head, and I can see, is the bone being eaten away around the end of this root? Can I see it? That's when my stance changed. Because about 10 years ago, I started taking these cone beam CT scans just routinely on everybody, and I was absolutely floored at the number of root canals I was seeing that had huge abscesses at the end that I couldn't see. And I'll always remember the first one that really changed my mind. It was a woman who came in, she'd had a root canal done years ago, and she said, it's just never felt right. It just kind of feels odd. It just doesn't feel right. I don't know, it doesn't hurt, but it just doesn't feel right. And I took a regular dental x-ray. I said, it looks great. And any dentist would have looked at it and said, It looks great. I'd said the same thing to so many people. It looks great. And I just gotten this cone beam CT machine in the office. I mean, these are not cheap. They're $100,000 machines. Okay. So I just got this machine in the office. I said, you know what? Let's go take a scan. I'm just so curious. I took a scan. There was a quarter size hole of bone that had been eaten away above the end of that root and the tooth behind it from that root canal failing. And I could not see it on the dental. I couldn't see it.
Quarter size hole in the bone, the tooth,
Jawbone.
in the
Eaten
jawbone.
away, full of bugs, full of infection. I could not see it on the dental.
Wow.
And I went, I will never not take one of these scans on someone who's
Wow.
that. I will never do it again. And so now what I see is I take a scan on, so I every single new patient now that comes to my office gets one of these scans. And I would say 80 to 90% of root canals that I see have new infection around the end of the root somewhere. So now every single time you chew on that tooth, you're driving that bacteria through the entire bloodstream because that bone has blood in it and you're driving it through the entire bloodstream. It's causing a low-grade acute inflammatory situation throughout your system 24/7.
Wow.
So again, I say, okay, the idea of a root canal is so awesome, but is the implication of it worth it? Is the side effect worth it?
Yeah.
And you said no by your choice. You said, no, it's not actually worth it because here's the great news. We can replace it. This tooth right here on me, it's an implant. It's a dental implant. Can you tell?
I can't tell.
It smiles like a tooth. I mean, it looks awesome, right? And it's been here for 20 years. Now we even have better implants than this one is. Now we have ceramic dental implants. So they're completely ceramic, top to bottom, no metal at all. They're amazing. And that's how we replace teeth now. Sometimes you don't even need to replace a tooth. I mean, some people are like, you know what? I don't miss it. Great. You're fine then. You're fine without the tooth completely. You have a lot of them. So losing one way in the back, it might be okay. Is it worth the side effect? Is it worth the downstream immune system, immune compromising effects of a very high risk factor, of actually new infection? Is it worth that risk?
Yeah.
Some people might say yes. And on a kiddo, if you have a kid that's broken off a front tooth in an accident, you know what? I might do a root canal in that kiddo because it might be that saves them and gives them a tooth until they're 21 years old and I can do an implant in them. So there's situations where maybe it's worth it. Maybe you say, yeah, you know what? Actually, yeah, it's worth it for me right now to get a root canal today, knowing it's a short-term temporary solution for me.
Yeah.
I'm going to probably have this tooth taken out in a couple of years from now. And I'm going to watch my symptoms real close in the meantime.
Yeah.
That's the problem.
And that's kind of where I came down to too. I said, you know what, if I got the root canal, it was like, I know in the back of my mind, based on the research I've done, I'm always going to wonder in 5 years, 10 years, is this symptom or health condition I'm experiencing now because of my root canal? Like it always would be there at the back of my head. And I didn't want a temporary solution. Like, I'm 39. I plan to live into my 90s. I need something that's going to last me 50 years. Well, root canals don't last that long. Like I think I even asked the dentist recommending root canals, how long do they last? And they're like, oh, you can get one that lasts 10, 15, sometimes 20 years. I'm like, well, I need it longer than that. Like I'm planning to live longer than 20 years.
And then what?
Right. And then what? You're just prolonging getting it removed again. And whatever health consequences you have in between that time, I'm going to have to deal with that. And like you mentioned, the bone disease, the infection will eventually develop. I won't feel it. It'll eat away at my gums. I already have the receding of my jawbone, which we could tell on the CT scan that I had like two of them taken. So I've got that going on, and that might be from grinding. It might be from the infection. I don't know, but they showed me on the CBT scan, the polyp at the bottom of my tooth and that the root had died. And as you were talking, I'm realizing, oh my gosh, if I had taken this scan weeks ahead, it's possible, or months ahead, I'm not sure how quickly this stuff develops. It's possible it could have saved the tooth. It was a deep cavity. It was an old cavity that had to be replaced, and then it got deep. And ever since that cavity was refilled, it was the hot, cold sensitivity. And it got more and more and more painful until the point that it got, like you said, went through the dentin into the nerve, killed the nerve, the infection developed. But, I'm facing this going, okay, my tooth is in a lot of pain. The dentists all agree it's the nerve is dead or almost dead, dying. And so you can't save it at that point. Probably could have saved it if I had known earlier what you're saying, if I had come to see you. That's why I say go see your dentist, ladies. Dental issues, they only kind of progressively get worse if you don't intervene. And so important to get in and get it taken care of. And so I just knew like it just makes sense to me, everything you're saying. Like you take out the nerve, you take out the blood supply, you can't feel it, but it's still open. You're never fully sealing it off. You can never get all the germs and bacteria out of those little tubules that go laterally along your mouth. And so the dentist may say, oh, it's a healthy tooth, don't remove it. How long is a healthy tooth healthy if you cut off the oxygen and blood supply?
Yeah.
It dies. No organ that you cut off a blood supply to or any part of your body is going to live. It's a necrotic tooth. So eventually, it's not if, it's when this root canal will fail and get infected. And it often will get infected long before you realize it, or can, have the wherewithal to go in and get a CT scan, this cone scan she's talking about. And by then, how many other health implications has it affected? Is this part contributing to your fatigue? Sometimes I think we think as new moms, right? We're raising this little baby and we're like, oh, this is so hard. I'm so tired. What if it's not just your baby making you tired, but it's an oral health issue? It's an autoimmune issue. It's something else going on in your body that you may not have considered. And I think sometimes it's that we need that light bulb moment as moms, because we take care of ourselves last, whether we've got little toddlers, whether we're preparing for birth or raising these kids. And we don't realize that, man, this isn't just motherhood making me tired. Maybe there's other things going on here. And I need to get in there and get checked out, get these things evaluated and rule out a few things, because you're not supposed to feel exhausted and fatigued all the time. Autoimmune disease isn't normal. Cavities are not normal. Like root canals and having your teeth have an explosion of cavities, that's not normal. There's other things going on. You don't have to feel that way. Just like I say, you don't have to feel terrible in pregnancy. There are things we can do in our health that can actually prime us to thriving. And sometimes it takes a little research or a little work, or you have to spend some money to get these things taken care of. But in the long run, you're taking care of yourself, you're being the best mom for your kids, and you're setting yourself up for a healthier pregnancy, birth, postpartum, and in the long run, it's worth it. And so I chose the long-term solution, even though it was more painful in the short term and more expensive. It was get this tooth taken out so that there's not a dead tooth sitting in my mouth of just inviting bacteria and infection.
Yep. Good choice. Good choice.
Thank you. Feels good to have a dentist say that, because all the other dentists were like, why would you take out a healthy tooth?
Yeah, not healthy. That's the problem. It's not healthy.
Because it's not going to be, it's not healthy when you cut off the oxygen. And I want to be healthy. I want to be healthy holistically moving forward. So, thank you. This has been such good information for mothers, for anyone listening. Is there anything else you want to share on that you feel like our listeners really need to know in their journey of dental and oral health and overall health?
I do think it's important to understand a little bit about the child development as well.
Yes, I was going to ask and I forgot. Thank you.
Yeah, it's interesting because, again, back to the 1930s, there was a doctor named Dr. Weston Price. He was a dentist, and he was actually the head of the research department of the American Dental Association. And he was disturbed by the number of cavities in kids. Yeah. So he took 10 years and he went and traveled the world, found indigenous societies, so places where the modern diet, modern kind of medicine hadn't touched yet. And the beautiful thing about his research is that he had a camera, so he could take pictures of what he found, which was really pretty cool. We couldn't do this today because we couldn't find places that haven't been touched by modern diets and modern medicine. And, it doesn't exist. But because we have his photography, his photographic evidence, as well as the research, and what he was finding is exactly what you were explaining earlier about the growth and development of faces, about facial structures, about overall health. And he was studying how does what people eat pre-conception, during pregnancy, postpartum, how does this affect the growth and development of children? And he found that there were a lot of diets very specific for both mom and dad, even preconception, to be able to make it so the baby had a better chance of being healthy. It's really fascinating research, and it still stands up today. Like literally almost 100 years ago, this research is still standing up today. And one of the things he found is that the top job is the first bone affected by malnutrition. And it's really interesting because my son, when we adopted him, he was 2.5 years old, and his top jaw was so small, it was actually inside of his bottom jaw, which it shouldn't be. Like, you should have the top jaw should be wider than the bottom jaw. He'd been so malnourished, and we have been fighting this for 15 years, 16 years to try to get his teeth and jaws to grow, everything else. So that malnourishment shows up in facial structures. And when there is small facial structures, it affects breathing. Well, breathing affects growth and development.
Yeah.
If you can't nose breathe, if baby can't nose breathe, if they can't get enough air in, then they can't get growth hormones stimulated. And you're going to see then an increase in this deficiency. So the fact that the nutrition levels weren't there to begin with creates a small jaw. Then you can't breathe very well, which then perpetuates the issue. Basically, growth and development doesn't happen. So if you have kiddos that are having issues with growth and development issues, they're very small, focus problems, a lot of ADHD symptoms, that sort of thing, bedwetting, loud breathing at night, you can hear them the second they go to sleep. All these things are evidence that they are not getting the air they need, and they are not going to be able to grow like they should. This goes for you too, moms. If you are not able to breathe through your nose, if you're not able to get the air you need to sleep at night, then it's going to impact a lot of things. So there's a lot that goes on with the facial structures here that are really important to know. So finding an orthodontist that's actually aware of functional issues. There's an organization online called toothpillow.com. I really highly recommend them because they'll do everything virtually for you. So if you have a child that has any of these issues, they're mouth breathing at night, you should never mouth breathe. If you're mouth breathing, things are not going correctly with your growth and development, ADHD, bedwetting, check out toothpillow.com. And they're going to tell you how you can actually work to grow the mouths properly, to grow all these structures properly so that you can get proper air for proper growth. And a lot of these go away. A lot of these things go away. So there's a lot going on. And then mom is the same for you too. There's a lot of things we can do from a growth standpoint for you as well. Even after you're old, even after you're not a kid anymore, a lot of things, because oxygen is so essential for every single, like you'd said, you can't cut off the oxygen to the tooth. Well, you can't cut off the oxygen to you. And
to your body.
Operate very well as well. So if you're mouth breathing, if you have attention issue, like focus issues, memory issues, a lot of those things, most likely you're not getting the oxygen you need as well. So those are just some resources I always like to point out to people. Go check them out. I didn't get to talk much about it, but go check them out. There's information online that you can find.
That's so helpful. I know I'm looking into some of that too for my family. I've seen lots of people now with mouth tape that they put on at night to prevent the mouth breathing. And one of my daughters, well, both of them, two of them actually have gotten expanders because their jaws were so small. And so these are things I'm looking into too, right alongside you mamas and listeners. So I'm just so grateful, Michelle, for the information you're giving us. I feel like so much of this is actionable things that we can do as moms. And if anyone's overwhelmed listening to this, just take it one step at a time. Get yourself checked out first, make that dentist appointment, go on Michelle's website. Let me make sure I get the website name. It's livingwellwithdrmichelle.com.
Yeah, Living Well with Dr. Michelle. Yep, there's all sorts of stuff on there. Go on Instagram too. I mean, if you are feeling overwhelmed, just go find the one topic you want to learn about. Yeah, you'll know in your spirit, like, what's the one thing you need to take action on today? And then just make a list and just, make that dentist appointment for your kids or orthodontist appointment. I'm going to look at toothpillow.com because really it's holistic health, right? It's growth hormones, it's development, it's the mental health, everything is so connected. And so this has just been a goldmine of information. So thank you for everything you've shared. And we'll put all these links in the show notes as well. And some of the products that you discussed, the mouthwash, the toothpaste, all of that stuff, I'm definitely going to try those out as well. And thank you, Michelle, for joining us and for sharing everything you've shared. It's been truly just an honor to have you on this podcast. Thank you for the opportunity. I appreciate all you're doing.
Thanks. We'll see you guys next week. Thank you for listening to this episode of the Pain-Free Birth Podcast. If you were encouraged, it would mean so much if you left us a 5-star review and shared this with your community. I'd love to connect with you on Instagram at painfreebirth. And to learn more about the Pain-Free Birth e-course, free resources, private coaching, and upcoming events, find out more at painfreebirth.com. See you next week.